Welcome back to Heart Talks with Anita Bahal. I hope wherever you all are, you're having a lovely, lovely day. As you know, we are in a worldwide situation with COVID-19, and it is with a heavy heart that I am doing a segment with COVID-19. With me here today is Dr. Safraz Mohammed, a neurosurgeon in Ottawa, and I was hoping that with this segment, we can shed some light and some information in a very simplistic way on COVID-19. As we know, it is very important to educate ourselves and our fellow men to flatten the curve. And this is what we hope to do today. And we hope that you share this video and we help each other to flatten the curve. So let's welcome here Dr. Safraz Mohammed as we venture into COVID-19. So our first question here for Dr. Mohammed would be, what is COVID-19?
So first of all, Anita, thanks for having me on your Heart to Heart. What is COVID-19? So COVID-19 is a virus that affects the respiratory tract and of humans. It was first originated in Wuhan, China, and then rapidly spread throughout the world. And as you know, we're currently in a pandemic.
So is it definitely originated in Wuhan, or is it believed to be?
I think it's believed to be, but most people would say it's definitely originated.
Okay. Well, it doesn't matter where it's originated now per se, because it's affecting all of us today. And it's very important that we look into how it is spread most importantly. But before we get into that, a lot of people was thinking that I have been talking to my friends, and I've been a lot on media, and even family, friends, and acquaintances has told me that it is so similar to the flu. And I myself at the beginning thought it was very similar to the flu. Can you expand on that for us?
Sure. So it is similar to the flu in the way it is transmitted. The flu, like the COVID-19, is transmitted through aerosolize. So when people breathe, sneeze, cough, particles from their mouth and nose will go into the atmosphere. So it's aerosolized and airborne or droplets. So droplets from your mouth and nose will go into the air, and then if someone else inhales that, that's how it could be transmitted. Also, through contact. So someone with a sneeze or touch a surface, then that surface has the virus. And the virus has been known to live in, for example, on cardboard surface for up to 24 hours and on steel or copper surfaces for up to 72 hours. And that will have an impact on lots of things that we do on a day-to-day basis. So that's how it's similar to the influenza.
So it's very similar in terms of its transmission.
It's very
But what
similar
about in terms of its death rate? Because a lot of people are taking it very lightly. As I said, even myself at the beginning, I didn't want to alarm myself, and I try not to get alarmed right now, but I did associate it with the influenza virus and the common cold. But can you tell us a little more about, in terms of the death rate between the virus and between the influenza virus and COVID-19, so to explain to the public very simply, so that they can understand this situation better?
So the influenza virus kills people every year. And the death rate for influenza is about 0.1% globally. The death rate currently for COVID-19 globally is about 4.8%, let's say 5%. So 5 in 100 people will die. But it varies from place to place. In Italy, for example, which is the hardest hit area, their death rate was 11%. Now, if you compare 0.1% death rate for the influenza virus or the common flu to 11%, which is the death rate in Italy, you're looking at 110 times more death rate for COVID-19 than it is for influenza.
Are you guys hearing that? Let me just butt in there. 110 times more, and it varies place to place. Why is it varying place to place? What is bringing about? Is it the population, the density of the population,
so
people not listening?
There are several factors, and again, we don't know all the factors. Nobody knows all the factors. But factors such as age of the population. So in Italy, we think there was a older population, and therefore they are more at risk for COVID-19. However, we have seen in areas of Spain, France, and then in the US currently, and even in Canada, that younger patients are being affected, in particular in the US. So patients who are in their 20s, who have no comorbidities, no diseases, perfectly healthy, athletic people, ended up with the disease and have died from the disease.
I'm very glad you said that on a lighter note in terms of education, because initially, and I think currently, even in my hometown in Trinidad and Tobago, a lot of people continue to believe it is only affecting the elderly. And I hope you guys have heard that. It's not only affecting the elderly, it is quite dangerous and is affecting people who are very, very healthy. On that note also, you said that it was spread via droplets as well as contact. How infectious would a person be at different stages in terms of whether they have it, don't have it, recovering? Can you spread also some light on this?
Sure. So the WHO says that the transmissibility of COVID is 2 to 5, which just means that for every one person that gets COVID-19, they will send it to 2 to 5 people. And that's a conservative estimate. So it could be even as high as even 10 potentially, but we don't know that right
10
now.
per day, 10.
This is for every contact, for every one person, they may spread it to 2 to 5 other people.
Okay.
This is what it means. And we don't know if it's per day or whatever, or over a period of time.
But when is it most contagious? Is it...
So that's a good question. The initial evidence suggests that only patients who are symptomatic will spread the disease. But as the pandemic progressed, we've recognized that patients who are asymptomatic, which means that they have no symptoms, can be COVID positive and also transmit the disease. And recent studies show that people who have recovered from the COVID-19, their sputum also has live COVID virus. So now WHO suspects that people who have recovered from the virus can also spread it. So people who are non-symptomatic can spread it, people who have symptoms could definitely spread it, and people who have recovered from it may potentially be spreading the disease also.
Now that is awakening, because I would think once you are recovered, you wouldn't be able to spread it. And I would also think that you had no symptoms, you weren't able to spread it. And this is very alarming. I hope that you guys are really, really, really listening to this. You can have no symptoms yet spread it. You can be fully recovered and still spread it. You clearly, when you have it, you can spread it. But the other two are quite interesting to know. Now, one of the things also, a lot of people, I know we are grateful, those who are home and safe and have food, and we are enjoying our family time. We are trying to make the best of the situation, and we are trying to stay home, many of us. But how is this affecting healthcare in its totality, in your view? For example, in terms of not just the COVID-19 patients that are coming in, but all people who need medical care.
Sure. Just because there is a pandemic doesn't mean that other diseases, other illnesses stop happening. People are still getting heart attacks, people are still getting strokes, people are still having appendix that need to be removed. And the hospital is now trying to focus on emergency situations because we're trying to prevent people from coming to the hospitals. So elective practices such as clinics and elective surgeries have all been shut down essentially. And what we have is running an emergency service only. But with the influx of COVID patients, this is across the world, with the influx of COVID patients into the hospital, then other diseases aren't being treated as they should be because of resources. So for example, in Italy where this happened, patients who were having strokes and heart attacks had to be triaged in terms of if the hospital was able to take care of these patients. And some of them were being denied care for the simple reason that the hospital was overwhelmed, that the resources were already being stretched in. So the pandemic certainly has an impact on lots of patients out there with diseases that needs to be treated.
So just to stop you right there, Dr. Mohammed, one of the things that also I came in contact with, I have a friend who was undergoing chemotherapy at this time, a cancer patient, and she was unable to go. They told her that her visits were cancelled. I have family members who were supposed to see specialists, things that seemed very concerning to them with their health, and they're unable to go because not only resources are probably being overwhelmed, as you said, but also because they do not want other people coming in to spread the disease. Is that true?
And it is true. It's a risk to benefit ratio. For example, that friend with cancer that you mentioned who requires chemotherapy and is not able to get chemotherapy, if that patient were to go to hospital and because that person is immunocompromised, having received chemotherapy, then they're more prone to get the infection. So it's a risk to benefit ratio. We could bring this patient in and treat them with chemotherapy to help treat their cancer, but then subject them to a risk of COVID-19 where death might be possible. Then it's best to not treat this patient with cancer.
Guys, are you hearing this? We have to flatten this curve, because not only are we helping ourselves and helping our fellow men and helping the whole world to return to, of course, we have learned many things from this, but we are not talking about that. We are talking about to return to just life, to be alive, to prevent all these deaths, all these unnecessary deaths, but also for those who are currently undergoing health situations and cannot receive the service as required, because if they go, they are unsure if these people who have their immunity being suppressed is the correct word there, doctor, the immunity is already, it's not working 100%. They don't want them to get COVID-19. Also, I've been looking a lot about the media, Dr. Mohammed, and my heart goes out to all those frontline workers. I really, tears came out yesterday while I was sitting alone, and I have a friend on the front line, and it's very, very, very scary. In fact, I have one of my friends on the front line in Trinidad and Tobago, and I spoke to that individual, and it was very, very saddened, because at sometimes, from what I'm hearing, there's not always proper equipment. Could you tell us more in terms of the equipment and also people using masks? How is this helping them, etc.? And what do you think also about, in your view, that people who are going to work without the proper gear and risking their lives and their families? Can you shed some light again on this?
So you mentioned frontline workers. Obviously, we want to protect the healthcare workers, and the healthcare workers need to protect themselves, and that's why they wear personal protection equipment. These include things like hats, gowns, masks, shields, gloves, etc. Now, these are premium because in order for a healthcare worker to take care of patients, they have to use these equipment and then change it when going to see another patient or when going to do something else. So the amount of personal protection equipment that they use on a given day is quite a lot. And so while healthcare workers want to help, they want to do for their patients, this is ingrained in them. They want to do as best as they can. They also do not want to subject themselves to work in an environment where they don't have the protection for a couple of reasons. One, they don't want to get sick. Nobody wants to get sick. Two, they don't want to subject their family to illness when they come home. But three, which is very, very important, if they get sick, they could transmit the infection to other patients that they are taking care of. And this is one of the things that happened in Italy, where sometimes half of the healthcare workers in a hospital were infected, and therefore transmission to other patients happened. This is one of the reasons why there was such high transmission rates within the hospital. So we need to protect the healthcare workers.
Yes, but I agree we need to protect them, but what will happen, for example, do you think supplies are going to run out for them? Like, what is the situation in terms of, I've been reading a lot that in some places, some nurses are going out there without proper protective equipment. What are your views on this? And in first world countries like Canada, the US, they are running out of supplies. They are probably getting overwhelmed. What can you say about third world countries in this respect? And what do you think should be, I know each person will have their own personal view, but do you think us as humans and our fellow brothers and sisters, do you think it is really right for them to be acting on the front lines without proper equipment?
No, it's not right. It's not right to put a worker in a height, for example, without harnesses. It's against OSHA guidelines. It's against work safety guidelines. Same thing that applies to healthcare workers. It's while they want to help, and they are helping, and they're going above and beyond the duty, putting healthcare workers subjected to improper personal protection equipment to try and take care of patients is wrong, and hospitals and governments have been actively helping the healthcare workers. They have been doing this, and one of the ways that you, the individual who's listening to this, can help the healthcare workers is by, if you have masks, if you have personal protection equipment, donate it to the hospital.
Are you hearing that, guys? Please, if you have protective masks, donate it to the hospital. But Dr. Mohammed, what I've been seeing here is that a lot of people, when I look at videos, a lot of them are walking around to groceries. They're having their mask on. What about this? What about, should I be having a mask on myself when I venture outside to make my groceries? What is your view on people using the mask themselves instead of donating it to the hospitals and the frontline workers?
That's an excellent, very controversial question. The CDC has made many recommendations over this, and their recommendations have changed over time. Likewise, the WHO have changed over time because of this evolving pandemic that we've had. With the healthcare, with some of these masks, for example, the most commonly used one is the N95 mask.
N95?
N95, which means that it will filter off 95% of all the particles that will go through it. The N95 mask is commonly used by healthcare workers, but for someone to use an N95 mask, for example, myself, I have to be fitted for it because there are several types of N95 masks, several shapes and sizes, and has to fit to create an airtight seal around your nose and mouth. And has to be tested to make sure that this is the proper mask. So someone on the outside, the general public, who's wearing one of these masks is obviously not been tested for it, not been fitted for it, and can give a false sense of security to that person because it's only partially helping or probably not helping this person at all. So the best thing to do with this N95 mask is give it to the healthcare workers who can be fitted, who have been fitted, have been tested for it, and know which mask that they use. The best thing that you can do, the person who's listening to this video right now, watching this video from the general public, the best thing you can do to help, as Anita said, flatten the curve is by staying home. I'll give you an example of flattening the curve mean. For example, in one hospital, let's just say 3 stroke patients come in every single day. A hospital could handle 3 stroke patients every single day. And 3 stroke patients every single day means slightly over 1,000 stroke patients in a year's time. If we had 3 a day, we could handle 3 a day. But imagine we had 500 in a month. We had half the people coming in 1 month. The hospital can no way handle that. So flattening the curve means that if we get COVID-19 patients coming into the hospital in very low numbers over a period of time, the hospital could manage. But if you have a whole group of people coming in all at once, the hospital is being overwhelmed, they cannot manage, and that's when things go crazy.
So definitely what we are saying here is that we cannot have our hospitals being overwhelmed. We need our frontline workers to be well equipped. And also if we do have masks, remember that we are not 100% protected, and it is best to donate it to the hospitals, as you were saying. Now, again, I had a friend who I said was on the front line, and I want to reiterate here a very important point. As I said, a lot of people think it's elderly people that are getting, who are dying, who are dying from the disease. And I want to ask a question because my friend at the front line told me that they were going from 100% health to 0%. What does that mean? And he used a beautiful word. He said, I mean, the word is beautiful. It's not so beautiful in terms of what's happening right now, people. But he said that it was volatile. The situation was volatile. So could you explain to me what it means from going from 100% to 0% health-wise, and what it means in terms of volatility for the situation?
I think what your friend meant when he says going from 100 to 0 is that, first of all, addressing your first question about is it only the elderly, and the answer is no. It was initially thought that primarily the elderly people were affected. But now we know that there are young, healthy people who are dying from this. Young meaning in their early 20s, who have no symptoms, who are athletes, who have no medical diseases, who are getting this respiratory illness, COVID-19, and dying from respiratory complications. And it can happen suddenly. It can happen within a matter of days that people are dying. And therefore, staying home and trying to avoid this is best. When I say staying home and self-quarantine, self-isolation, all these things will help prevent you from getting the disease, will help with the hospital situation. In terms of going from 100 to 0, this is exactly what the person is referring to, is that patients may come in with little symptoms initially, and these symptoms may progress very rapidly over a short period of time, resulting in death or resulting in significant morbidity. So even when patients survive the COVID-19, so they get the disease, they survive it, many of them walk away with sometimes 1/3 of their lung capacity gone. So 1/3 of your lung capacity gone means that you're not able to run as you did before. You're not able to work and exercise as you did before.
Okay, so you were saying that, and it really hit me hard there, because last night I was looking at TV with my 3 children, and I did look at them, and I don't want to scare anyone here, but education is key, and I looked at them and thought, wow, I have 3 healthy young kids, and we just don't know what the future holds. And I just want to tell you all, please know, we all have to do our part, as Dr. Mohammed is saying here, to stay home, to do social distancing, to be more aware, to donate our mask to the hospitals, to learn that it's not only for the elderly and for the young as well. We are all in this together, and we all have to do our part. Also, we talked about how it's affecting people who don't have the disease and cannot get their health care. I was also concerned about a certain group of people, having gone through it myself. When people are depressed, I want to ask you, this is a very much concern, because now that we are all into social isolation and social distancing, quarantine, people who already were depressed, staying inside in a quarantine sort of situation, how do you think this whole pandemic is affecting such?
Oh, that's a very good question. So people who are not depressed can become depressed from social isolation, from being away from the entire world. But people who are already depressed, who are undergoing treatment for depression, their depression can be exacerbated, can precipitate more. How do we avoid this? Whether you have a history of depression or you're currently being treated for depression, the best way to avoid this is by exercise, by healthy eating. Yes, you can't interact with people face to face, but you could pick up the phone. And there are so many avenues now for video conferencing, for talking to people, WhatsApp and video calling and FaceTime, for example, that anywhere in the world that you could get in contact with people. Pick up the phone and call 5 people today. Pick up the phone and just call 5 people and say, hey, I'm thinking about you. What's going on? Is the family safe? And if you do that every single day or every single week, just call 5 people. It's going to help you and help them in the long term.
Thank you very much for that, because I am concerned about that. I myself went through a period of, I would say, depression, and I can't imagine going through this right now at this time, COVID-19, not having that support I used to have. So we need to all support each other. Please don't forget that we have so much other issues, not just COVID-19, but definitely why we need to flatten the curve and fast, because we need to help even all these other people who are being affected. Another thing I want to say, heart to heart is about loving ourselves, about being our best self. And on that note,